Healthier with Nature, our local green social prescribing programme is about transforming the delivery of healthcare, placing good mental and physical health at the heart of people's lives in their local communities. It builds on individual interests and empowers people to play an active role in developing and maintaining their health.
It's about reconnecting with nature.
It's about watching things grow.
It's all about partnership working.
It is about challenging yourself.
It's about improving your own well-being.
The Green Social Prescribing Pilot is a national cross-governmental programme, and in the Southwest we have one of the 7 test and learn sites exploring the impact of green social prescribing on people's mental health and understanding what is needed to connect people with green social prescribing activities.
So in each of our council areas, money has been invested into projects so that people can get access to green social prescribing.
I feel that nature is part of a wonderful toolkit that we can use to really help people improve their health and well-being, to reduce health inequalities because it is available, because it is free. And there's a really amazing array of different projects for different individuals, and that's a wonderful resource. Heart of BS13 is an organisation which is committed to reducing food insecurity and health inequality. And what we do here at the Garden is we offer green social prescribing programmes and volunteering opportunities, which we hope will provide pathways to people. And what we notice after a few weeks of coming on a weekly basis to the Garden is people really start to open up. They start to become more confident, not only with what they're doing in the garden, but also with each other. When you learn about soil and you realise the world, the universe of life that is going on down there, I think it helps us recalibrate where we all are in the scheme of things.
There are so many connections between being physically active, between the arts, nature, skills, education. They're all connected, and that's why it's so important for us as funders to find ways in which we can connect our work to make it that much easier for community organisations.
We've looked at sharing our processes around performance management and data collection to ensure we've made the process as simple as possible for the organisations on the ground.
Grassroots Communities is a youth and community organisation based in South Bristol that supports young people from marginalised communities to be the changes they want to see and be. And we've been working with a group at Bridge Learning Campus.
We predominantly identified a group of Year 8 and 9 students to work with the Grassroots project. These students were chosen because they have quite significant speech and language issues, and these issues are having a real impact on their mental health and well-being and also their educational outcomes. And through charities like Grassroots, we are able to take these children away and do things and give them experiences that they would never have. We went to Poets Walk in Clevedon, and they could not stop talking about the flowers and the trees that Ben had shown them.
Different plants that help with your well-being, different plants you can eat. Then we were doing things like breathing techniques and meditation. We even done an Indian sun dance.
At first I didn't want to do it, but when I done it, I was like, wow, all my worries and stress have gone.
We've been delivering green social prescribing project in Bristol, especially the area in Loras Hill, Easton and St. Paul's. And the program aims to connect disadvantaged community groups to the green space and the nature. The target group has no connection to the nature. We engage them and we bring to the green spaces like the parks and and the program encourage people to use the community assets. And we give them space to talk about their mental well-being and how they feel, which is important in post-COVID period. This program is connecting people to people and also people to nature, and that's important.
I would like to encourage young people, especially around Bristol in the Somali community, to get involved in these activities for their mental well-being and also to connect with other people in their community.
And the green social prescribing, although we apply for just 1 year, it positively impacted the community.
It's all about discovering the green and blue places all around us.
Getting your hands dirty, doing a bit of gardening, helping around the park. It thoroughly helps and takes your mind off of stuff that's happened to you in the past. And helps me get through the day, really.
Roots to Wellbeing is a green social prescribing project that we run at your park in partnership with the Bristol City Council, and it's for people who are maybe experiencing some mental health difficulties or suffering from loneliness. We do a little bit of gardening, some light agriculture in the parks, and then we like to finish with a relaxation or a meditation mindfulness activity.
It's about finding yourself.
It's about building trusted relationships between communities and funders.
It's about reconnecting with the seasons.
Bristol Mind is a charity, and in partnership with St. Wilburg City Farm, we run the Green Space project. Our participants are asylum seekers and refugees that live in Bristol. And through this project, we try to improve their mental well-being. The beauty with this partnership that we have this amazing location that we can enjoy. Our participants join us for 3.5 hours of fun that starts with English classes. The benefits of being in nature, it is for people to have an activity outside their residence and be introduced to various different green spaces that Bristol has to offer.
We've had an active nature and health strategy group since 2016, which brings together the NHS, public health, environmental NGOs, universities and experts in the field to work on nature and health as a sector. The Green Social Prescribing project has been incredibly important in reiterating this partnership working, bringing people together towards a common goal of increasing and improving green social prescribing in the region.
Just as nature needs to be better connected, that's also the case with our service areas and our work, and I'm really excited to see the results of this innovative project already taking shape across our region.
Over the last 3 years, we've all had access to social prescribing link workers in all of our surgeries. They've been really helpful for just supporting individuals who've actually got problems they come to the GP with, but actually aren't medical.
I'm a social prescribing link worker in North Bristol, and I work with the Southmead Development Trust. It's all about enabling people to have that space to have a conversation, giving people time and focusing on what matters to the individual.
I'm diagnosed with mental health issues and are medicated for it. So being outside helps with that anxiety associated with that. And it does help to be active and to walk places and get outdoors as much as you can.
We're a new community gardening group based in the Wellspring settlement here in Barton Hill. We offer inclusive, accessible gardening activities, green craft activities, and a chance for people to sit together, garden together, talk together, share skills, and just connecting with the nature that is in this little pocket in the middle of the city. We're transforming the green spaces here so that people can feel really, really proud of the beautiful, colourful, vibrant growing that we've got going on. Lots of the people that come along to the sessions don't have a garden of their own, so what we're trying to create is a home from home for people.
Yeah, I came here a couple of weeks ago with my support worker. We found this group online. It's nice to get out and do some gardening and meet new friends, new people. It's good for my mental health.
You'll feel benefits you don't even know you're getting, and you'll go home and you'll be so much better for it.
One of the key aspects of our green plan is looking at sustainable clinical care models. Green social prescribing fits in really well with that, in the sense of making sure that we allocate green social prescribing initiatives as a first-line treatment rather than a nice to have, and I'm very keen that that's part of the agenda for AWP going forward.
It's inspiring to see how many passionate, knowledgeable people there are in the west of England, striving to make sure that green social prescribing is embedded in the health and social care system.
My vision and hope, and I don't think it's unrealistic, is that the Healthier with Nature project will become something that becomes business as usual, something that's normal, and that will be good for everyone.
It's creating community.
It's about working together.
It's about being part of something that's bigger than yourself.
Across the west of England, we are lucky to have so many amazing natural spaces and nature-based projects. There is something out there for all ages, interests and abilities, and most of them are free. Through green social prescribing, we can all be healthier with nature.